Nurse Aide Test Prep DC. Question 1. Which approach is best for a client with dementia who becomes agitated during personal care? Option A. Use a firm tone to assert authority. Option B. Provide simple explanations and allow choices when possible. Option C. Complete care quickly regardless of the client's response. Option D. Skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example: would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 2. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A. Feed the client quickly. Option B. Provide verbal cues to chew and swallow. Option C. Puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues. Example: chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 3. Normal oral temperature range is: Option A. 96.0 to 97.5 degrees Fahrenheit. Option B. 97.6 to 99.6 degrees Fahrenheit. Option C. 98.6 to 100.6 degrees Fahrenheit. Option D. 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B. 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 4. The chain of infection includes: Option A. Pathogen, host, transmission route. Option B. Air, water, food. Option C. Bacteria, viruses, fungi. Option D. Skin, blood, mucous membranes. The correct answer is option A. Pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example: hand hygiene breaks the mode of transmission. Question 5. The family of a dying client is upset. The nurse aide should: Option A. Ask the family to leave. Option B. Offer support and a private place to talk. Option C. Ignore the family. Option D. Tell the family everything will be fine. The correct answer is option B. Offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 6. What is the proper ratio of bleach to water for disinfecting surfaces? Option A. 1:1. Option B. 1:10. Option C. 1:100. Option D. 10:1. The correct answer is option B. 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 7. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 8. A client complains of chest pain. The nurse aide should: Option A. Give the client an aspirin. Option B. Have the client lie down and call the nurse. Option C. Walk the client to the nurse's station. Option D. Wait to see if it resolves. The correct answer is option B. Have the client lie down and call the nurse. Chest pain requires immediate medical evaluation. Have the client lie down and call the nurse immediately. CNAs do not administer aspirin. Walking may worsen the condition. Waiting could be dangerous. Question 9. The pulse deficit refers to the difference between: Option A. Apical and radial pulses. Option B. Systolic and diastolic pressure. Option C. Radial and carotid pulses. Option D. Brachial and femoral pulses. The correct answer is option A. Apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 10. A client is bleeding profusely from a wound. The nurse aide should: Option A. Apply direct pressure to the wound. Option B. Apply a tourniquet. Option C. Elevate the wound. Option D. Apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 11. A client with dementia becomes aggressive. The nurse aide should: Option A. Restrain the client immediately. Option B. Remove themselves from the situation and seek help. Option C. Yell at the client to stop. Option D. Ignore the behavior. The correct answer is option B. Remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 12. Which position is best for taking a rectal temperature? Option A. Fowler's position. Option B. Dorsal recumbent. Option C. Sims position. Option D. Supine position. The correct answer is option C. Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 13. A client with dementia has difficulty eating. The nurse aide should: Option A. Feed the client quickly to ensure adequate nutrition. Option B. Allow plenty of time and provide cues to eat. Option C. Puree all food to make it easier. Option D. Skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example: pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 14. A client is angry and yelling. The nurse aide should: Option A. Yell back at the client. Option B. Leave the room and return later. Option C. Listen to the client's concerns and remain calm. Option D. Call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 15. When a client is being discharged, the nurse aide should: Option A. Assist with packing and ensure the client has their belongings. Option B. Tell the client to call if they need help. Option C. Let the client pack alone. Option D. Rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 16. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 17. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 18. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A. Use hand gestures and hope the client understands. Option B. Speak loudly and slowly. Option C. Use a trained medical interpreter. Option D. Ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 19. When assisting with meals, the nurse aide should: Option A. Place the food tray on the bed. Option B. Place the food tray within easy reach on the overbed table. Option C. Feed the client immediately. Option D. Leave the tray for the client to manage. The correct answer is option B. Place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 20. A client with a history of COPD should have a target SpO2 of: Option A. 100%. Option B. 94 to 98%. Option C. 88 to 92%. Option D. 85 to 88%. The correct answer is option C. 88 to 92%. For clients with COPD and chronic hypercapnia, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia. The target for healthy clients is 94 to 98%. Question 21. What is considered a normal blood pressure for an adult? Option A. 90/60 mmHg. Option B. 110/70 mmHg. Option C. 130/90 mmHg. Option D. 140/100 mmHg. The correct answer is option B. 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 22. The nurse aide's role in rehabilitation includes: Option A. Performing all ADLS for the client to save time. Option B. Encouraging the client to perform ADLS independently. Option C. Telling the client they cannot do anything. Option D. Leaving the client alone to figure it out. The correct answer is option B. Encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 23. What is the correct procedure for taking an oral temperature? Option A. Place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A. Place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 24. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 25. How should the nurse aide communicate with a client who has a hearing loss? Option A, face the client when speaking. Option B, repeat the statement. Option C, shout so that the client can hear. Option D, use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy.